We are all unique, which means our health needs are also unique. That's why when creating the Women's Health Plan, we listened to the voices and experiences of nearly 4,000 women across Wales. There are differences between groups of women with different characteristics. Intersectionality explains how different parts of our identity, like gender, ethnicity, disability, age, or where we live, overlap and shape our experiences. For example, a young woman living in the countryside might face very different challenges to an older woman in a city, like access to transport or hospital appointments. But what if that young woman is also disabled and from an ethnic community, or speaks Welsh as her first language? Those overlapping identities can make it harder to get the care she needs, leading to misunderstandings or further barriers to accessing services. Which is why the Women's Health Plan for Wales recognises that women are not one group, and that listening to women's lived experiences is essential to improving care. It reminds us that health isn't just about our body. It's about our physical health, mental health, and how society treats us and whether our voices are heard. The plan sets out nearly 60 actions across areas like menstrual health, menopause, pelvic health, and tackling violence against women. It's a commitment to creating services that are inclusive, so every woman can access the care she needs when she needs it. But we can't do it alone. Real change happens when we work together. Healthcare professionals, policymakers, communities, and importantly, women themselves. Because when we truly understand women's lives, we can truly improve women's health in Wales. By placing intersectionality at the centre of care together, we can build a healthcare system in Wales that works for everyone.